Yeah, Hudson Alpha has a great program in cancer research, and I can speak most confidently on the things that I've done in my own lab. But as you pointed out, we actually have work going on in a wide variety of different cancers. And so, some of the things that are important for cancer in general are identifying differences between different tumors that might make one treatment more effective than another for a particular individual, for a patient. And so that's certainly an area of research that sort of goes across the different types of cancer and is definitely something that was an important part of the recent publication that came out of my lab. And so we can talk a little bit about that in more detail, but the sort of short version is we collaborated with a GYN oncologist at University of Alabama in Birmingham. Her name's Rebecca Arend. She is a wonderful collaborator that we've been working with for quite some time. And we've been fortunate to do some genomic analysis of tissues and other samples from women who have had ovarian cancer. And we have a lot of questions about how we can help these women be more successful in their treatment, because unfortunately, some of the statistics surrounding ovarian cancer are not so uplifting. But we do know that we can, when we identify treatments that work well for patients, they often have a long period of remission, if not complete cure. And so our research is really focused on trying to understand, what are some of the markers that would show that a particular treatment would work well for a patient, or maybe a marker that indicates it wouldn't work so well. Um, and for those situations, we really want to know, well, if the standard treatment is not predicted to work very well, then what might work better? And so those are some of the topics that are covered in our recent publication.
That is really cool. Okay, couple questions to follow up on that particular subject. Does this mean when you're looking for different type of treatments, does that mean, well, maybe radiation is not a one size fit all type of treatment? Is that what you're saying?
That's kind of the general idea. So, in ovarian cancer in particular, there are some drugs that are used very commonly, not in every single patient, but in most patients. So, it's a chemotherapy called platinum based chemotherapy. So, there's different drugs, but they're all within that family. And a lot of women actually respond really well to those drugs initially, shortly after they're diagnosed. And so, but some don't. It's a minority. It's probably in the neighborhood of 15 to 20% of women don't respond very well to those. And sometimes that's because the cancer is advanced, and at that point it becomes harder to treat. But sometimes it's, the tumor itself, there's something about it that just doesn't really respond very well to the treatment. So some of the work that we did was using technology called RNA sequencing, which that's a lot of big words, but really what that means is we can measure what genes in the tumor are turned on and turned off. And when we look at that, we can say, if we compare samples from a patient who respond really well to the treatment versus those that didn't respond so well, what are the differences? And when we start looking at those things, we can say, okay, well, in general, the patients that are not responding well have maybe more activity of a particular set of genes. And maybe that tells us, okay, well, if we could identify a treatment or create a treatment that targeted that pathway or that set of genes, then maybe people would respond better to the treatments that we already have. So that's one way that we think about it. And I think there's a lot of opportunity for not just those standard chemotherapies, but there's other opportunities for what we sometimes call targeted treatments. Sometimes there's one particular example in ovarian and breast cancer that people might be familiar with. Certain women and men carry a change in a gene called BRCA1, which you might guess stands for breast cancer 1. There's also a BRCA2. And when people have those changes, either something that they inherited from their parents, or sometimes those changes occur in the tumors only, they respond really well to a certain set of drugs. So those are called targeted treatments, because we can actually test, hey, do you have a change in that gene? And if so, this might be a good treatment for you. So that's something that is becoming more and more common in the cancer world. And in ovarian cancer, which I've talked a little bit about, and also in pancreatic cancer, which is another cancer that we have worked on and are really interested in.
Fine.
Yeah, I mean, I think there's been some work at Hudson Alpha that's more on the diagnosis side, trying to use novel technologies to identify early markers of cancer. Much of that work has been, I think, published and talked about before. So I don't know that we necessarily need to rehash it, but I think it's just important to acknowledge that that's another place where genomic technology can be impactful. I mean, yes, I just think that it's a good day to remember to take care of yourself, to get those screenings. The best way to treat cancer, the easiest way to treat it is to find it as early as possible. So take care of your body, get your mammograms, all that good stuff. Not fun stuff, but it has to happen. That's the best way to keep yourself healthy. So that's all I would say.